Well, here in Wisconsin, we're all in the same boat. We can't wait for winter to end, but as we stare summer in the face, we're all scared to get into a swimsuit, right? You know what I'm talking about. So what's a girl to do? You might be tempted to hibernate, but that is not the right answer.
The truth is, there's a lot you can do to get your body ready for the summer, and that's from head to toe. So Dr. Deborah Manjoney is with the Wisconsin Vein Center and MediSpa, and she's going to help us get a little more summer ready. Because
we hope so.
Yeah, welcome to the show. The other day I was in the changing room and I was like, is it the mirrors or the lights in here? Because everything looks awful. But really, it's that we have hibernated throughout the winter.
Yes, and we store a little bit more fat maybe, and we come out for this very short season, and we're just not quite ready.
Exactly, we're not quite ready. So what can we do to be a little bit more ready or more confident?
Well, there are lots of things. I think we wanted to start with just talking a little bit about getting your body looking a little better. If you have some spot reduction to do, you know, you really can't do that with exercise.
Yes.
And so even if you're getting into shape and dieting and exercising, sometimes there are just those spots, little saddlebags or the underarm flab, as we were talking about. It is genetic, but it can be tightened. So now we have techniques using radio frequency heat to go over those areas to actually shrink the fat as well as tighten the skin.
Okay, so, because in the past we've heard about shrinking fat, but you wonder about all that loose skin.
Right,
so this
the
is
skin
kind of
tightens
like,
as well. Now, we can't accomplish huge reductions, you know. If somebody's lost 100 pounds, we're not going to be able to do anything to really make a significant change there. But if somebody just has some excess flab, or they had been very athletic in the past, now they're not, and they don't like how their body looks because of that, really we can make a difference with the arms, with the legs.
Well, I'm glad we have this
and the
tummy
abdomen.
picture, because a lot of moms
this
are
is
wondering
impressive.
about this.
Now, this is a man, an older man, that we worked on, and he was amazed. He went down 2 pant sizes.
Wow. Really?
Yes, and he really tightened up dramatically.
Now, did that include dieting as well?
No, he did not change weight at all.
Okay. Wow. Okay, wow. That is incredible.
Yeah.
And are you finding good results for moms related to tummies and the arm area? So those are 2 good areas to consider.
They are. Arms, I would say, are one of the more difficult areas just because there's so much you really have to go circumferentially, but it works.
Okay.
And again, abdomens, you know, waistlines, getting those reduced a little bit, the little extra flab somebody might have after pregnancy, really
I don't have any of that.
affected by that.
You don't even need to have had a child to have it.
Let's talk about laser hair removal. Do you want
hair,
to?
Sure, absolutely.
Okay, I mean, love it. I am a huge fan. And the people at the MediSpa who do this procedure, I love, and I think they do a great job. I mean, are my results typical?
Yes, they are. You know, occasionally you run into a person who doesn't respond as well as everybody else, but we do laser hair removal and get 85 to 90% reduction of hair after usually 6 treatments, because hair has different cycles of growth. And we have to hit it in the active growth phase in order to get it to go away, and that's why you need several treatments. Just like your hair doesn't grow always at the same length, some hair grows, you know, at different times than others, and that's why it's not always growing out in shape when it grows out. You know, it has to be recut.
Who's a good candidate? Because that's one thing we've talked about before, that somebody who's very fair-haired like myself can't necessarily do my legs because it's blonde hair.
True. If you have blonde hair, it does not respond well to any kind of laser treatment, because what laser is doing, it's attracted to what we call the chromophore, the pigment in the hair follicle. So it's what's below the surface of the skin that it's going to attack. However, using the laser we have, the 810 diode laser, really we can treat any darker color hair, any hair that has a different pigment tone from the skin around it.
Okay, so you don't have to be super dark hair. You just have to have difference between your skin tone and your hair color.
That's correct.
Okay.
Okay, so if you're darker skin,
you can still do it as long as you have black hair. Yes, or darker hair.
What about well, did I already say I'm a huge fan of the laser hair? Okay, just want to make sure it's out there. And you can do the bikini area too. It's really fantastic. Botox and wrinkle fillers. Another great thing for people to consider.
Great thing for the summer, because the summertime, you know, is that time when lots of family reunions or class reunions and things, and you don't have to worry about being out of the sun to do intense pulse light treatments or photo rejuvenation. We can do laser, we can do Botox and fillers. And
no,
really
this is a guy.
Yeah, we have guys come in.
Wow, he looks great.
He does. That's a big difference.
That after is a great result.
It really is.
And that's that, what do you call that area?
The nasolabial folds.
That's where it really age first, I think, or one of the first places it starts to show.
Even if it's not in the first place, by filling that area without overfilling, because we're very careful to try to make it look natural, by doing a filler in that area, you can easily take 10 years off of somebody's face in that one treatment.
You know, I'm surprised how many people do this, that it's not something that's reserved for celebrities or those who are uber wealthy or those who are even, I guess, overly into their looks. It's really just somebody who wants to feel a little better, feel a little younger. And I see a lot of women who are talking about it more, that it's not so embarrassing to admit.
I agree. I think in the last 5 years it's kind of come out to the forefront. People aren't afraid to admit they've tried Botox or they've used a filler, because everyone wants to continue to look more youthful if they feel that way.
Right. It's kind of like, what do you mean you haven't tried Botox? Okay, it's important to point out some of the treatments have an immediate result, like some that we saw. Others need a series of treatments. Real quickly, spider vein treatments. There are a lot of people who really have trouble wearing shorts and bathing suits because of spider veins.
And spider veins are a process for our treatment, and we'll talk about that more again next month when we really concentrate on veins. But we do tremendous work with spider veins. We use a combination of a laser on the surface as well as an injection sclerotherapy. It works very well, but it's usually going to take a minimum of 2 to 3 treatments to get the spider veins to go away 80 to 100% in an area.
But what a great confidence builder.
Yeah.
Oh, it is.
I think.
Being able to wear those shorts and those skirts again and feel good about it.
Definitely, because you can be very fit and still have spider veins. So I think that's an important point. If people want to get in touch with your office, here's what you need to do: is call this number on the screen. It's 262-746-9088, or go to WIMediSpa.com. That's the website. You're located in Pewaukee, just off Georgetown Drive. Easy to find too. Thanks for being here.
Thank you very much. You can also follow us on Facebook and Twitter now.
Oh, you guys are there too?
Yes.
We'll have to make sure we friend you today.
Oh, please do. Thank you.